Bismillahirrahmanirrahim. Assalamu alaikum. A 37-year-old man come to emergency department due to 2 days of progressive cloaky abdominal pain, abdominal distension, nausea, and vomiting. He had a similar episode 2 years ago that resolved spontaneously and did not require medical attention. He has no chronic medical condition. Temperature is 36, blood pressure is 122 by 80, and pulse is 92 per minute. The abdomen is distended and tender without rigidity or guarding. Abdominal X-ray is shown in the image below. Which of the following is the most likely diagnosis in this patient? So this patient is 37-year-old man. He comes to emergency department due to 2 days of progressive cloaky abdominal pain and abdominal distension with nausea and vomiting. He had similar episode 2 years ago that resolved spontaneously. The abdomen on palpation is distended and tender without rigidity or guarding. Based on these hand and the expression in this question below, the diagnosis of this question is cecal volvulus. And here the correct option is choice A. Why the choice A is the correct one? Because cecal volvulus occur when the cecum and ascending colon twist on their mesentery, forming a closed loop obstruction. Progressive abdominal pain and distension along with nausea, vomiting are typical sign for cecal volvulus. Abdominal X-ray may reveal a large dilated loop of colon. Constipation and advanced age are risk factor for both sigmoid and cecal volvulus. But cecal volvulus tend to be younger and often report prior self-resolving episode as this patient having. So I will show the photo of the cecal volvulus. So this is the cecal volvulus. I will highlight here that this is a dilated air-filled loop of the colon, and here is the normal descending and sigmoid colon. So this is the typical X-ray finding for the patient having cecal volvulus. Come to the incorrect one. Gastric outlet obstruction. So patient with gastric outlet obstruction typically reveal an enlarged gastric bubble with depressed bowel distally. Choice C, ileocecal intussusception. So ileocecal intussusception on X-ray typically reveal multiple dilated small bowel loops with air fluid level. Choice D, paralytic ileus. So patient having paralytic ileus typically causes generalized distension of the large and small bowel on X-ray. Choice E, toxic megacolon. Toxic megacolon and on X-ray typically reveal diffuse dilation of the colon rather than single dilated colonic loop. And patient will typically appear toxic. For example, patient will have fever, altered synovium, and often have bloody diarrhea. So here the correct option is choice A, cecal